Hello everyone, myself Ruchi Patel, working as an assistant professor at LJ College of Physiotherapy. Today I am going to take first year topic that is resisted exercises. And in resisted exercises, we are going to learn about the various resisted exercise regimens. In previous lecture, we have studied related to the DeLorme's, related to the Oxford and McQueen techniques. So in that, we are increasing and decreasing the weight gradually based on the technique. If we say related to the Oxford technique, then here we'll start our session with the 100% of the weight. So we'll give one set first, that is with the 100% of the decided weight workload. Then we'll give 75% of the workload, and then we'll give 50% of the workload. In the case of DeLorme's technique, we'll give the first 50% of the workload, then 75% of the workload, and in the third set, we'll give with the 100% of the workload. Whereas in the case of McQueen techniques, we'll give the constant workload that which we have decided, and we'll give the 4 sets of repetition, and then after every 1 or 2 weeks, we'll increase the workload. So for these all the regimens, first we have to decide the RM, that is repetition maximum. We'll decide the repetition maximum, or we can say another in the another word, that is 10 RM. 10 RM means with the particular workload, if the patient is able to lift and lower that particular weight for the 10 repetition, then that is called as the 10 RM. Okay, so in today's technique, we are going to learn about the DAPRE, that is the daily adjustable progressive resisted exercises. So here for the DAPRE, what we have to do, we have to decide our RM on daily base. And of course, that will be decided based on the previous days last repetition, like with the how much weight the patient is able to perform the exercises. Based on that, we'll decide whether we have to increase the workload or whether we have to decrease the workload. Okay, so the daily adjustable progressive resisted exercises DAPRE technique was developed clinically in an effort to provide an objective means of increasing resistance concurrently with the strength increases during the knee rehabilitation subsequently to the injuries or surgeries. So based on the patient's strength, we'll get to know whether we have to increase the weight or we should decrease the weight. Okay. So the key to the DAPRE technique is that on the third and fourth set of the exercise, the patient perform as many repetition as possible. We'll see in the chart form, or we can say in the table form, how we have to decide the workload. The number of repetition performed during the third and fourth sets is used to determine the amount of weight that is added to the working weight for the next set and the session. So based on the repetitions, how much repetition patient is able to perform on the third and fourth set, accordingly we'll decide like on the next day how much workload we should give. Okay. So consequently, the patient exercises near their optimal capacity during each weight rehabilitation session, and their strength redevelopment occur at a much faster rate. So here, of course, we are deciding or we are checking the RM every day, and we are giving the exercises with that particular workload. So it helps for the recovery of the patient as early as possible. Okay, so we don't have to wait for the 1 week, or we don't have to wait for the 2 weeks. Here every day the patient has to do with the new workload, so there will be less chances of the adaptation. And here also we are following every day, that is the overload principle, just to avoid the adaptation. So what is the DAPRE regiments? So first we'll decide the 6 RM. Okay, so 6 RM means with the maximum load, if the patient is able to lift and lower that weight for the 6 times without doing any accessories movement or without using any other muscle, then it is called as the 6 RM. And if we have decided that the person is able to perform 6 repetition with the maximum weight of 3 kg, then the person 6 RM has been decided. Now what we have to do, in the first set we have to give 10 repetition with the 50% of the 6 RM. So we'll give with the 1.5 kg of the weight, right? Then in the next set, we'll reduce the repetition. So here we are giving only 6 repetition, and we'll ask the patient to lift the 75% of the workload. So almost we can say around 2 kg weight, we'll ask the patient to lift, and the person will perform 6 repetition. Okay, then in the third set we have to give 100% of the workload. So 6 repetition with the workload which we have decided. So here we'll give with the 3 kg weight, and we'll ask the patient to perform maximum possible repetition. We are not giving the specific value that you have to repeat for this much repetition. So if patient is able to perform 5 repetition, then also it's good, and if he is able to perform more than 6 repetition, then also that is fine. And in the fourth set we have to give repetitions with the 100% of the adjusted working weight. Now we have to see what is 100% of the adjusted working weight. Before that, I'll repeat it again. So DAPRE technique, what we have to do, we have to decide first 6 RM. With the 50% of that workload, we'll give 10 repetition in the first set. In the second set, we'll give 6 repetitions. And in the third set, we'll give 100% of the workload, and we'll ask the patient to perform as much as repetition is possible. And for the fourth set, what we have to do, we'll give the repetition with the adjustable working weight. And here we have to decide the weight, and that how we have to decide that I'll tell you. So here you all can see. So suppose in the repetition in the set 3, if the patient is able, because here what we are saying, maximum possible repetition with the 100% of the weight, right? So if patient is able to perform 0 to 2 repetition, like if the patient is unable to perform more repetition, 0 to 2 repetition, then we'll decrease the weight in the 5 to 10 pound. Okay, so if patient is able to perform 3 to 4 repetition, then again we have to decrease the weight for the next day's session, correct? So that will be reduced, like 0 to 5 pound we have to reduce. Okay, so if, so we can say here, if repetition is less, we'll reduce the more weight, and if repetition is quite better, that is reduced only, but quite better compared to the first 0 to 2 repetition. So here we'll reduce the weight, but compared to the first, it is quite less. Okay. Then if person is able to perform 5 to 6 repetition with that 100% of the weight, then we'll keep the same weight for the next day. Okay. And if patient is able to perform 7 to 10 repetition, then we'll increase 5 to 10 pound. And if the person is able to perform more than 11 repetition or 11 repetition, then again will increase the more weight, that is 10 to 15 pound. Okay, so here we have to decide the weight for the set 4 based on the set 3 repetition, and based on the set 4 again we'll perform the exercises for the next day. Okay, and again we'll decide the workload for the next day. Okay, so first here important is repetition in the set 3. How much repetition the person is able to perform with the 100% of the weight, that help us to decide the set 4 workload and as well as for the next day workload. Okay, so this is a brief idea related to the DAPRE. You all can refer this DAPRE in the principles of exercise therapy from the Kiesner, as well as we all can refer the principles of exercise therapy by Dina Gardiner. And for the first year point of view, it is also uh, it is also useful that the Lakshmi Narayan book also you all can refer. Thank you.